Within the palliative care world, our toughest moments were the ones that we had to bear witness to. COVID has impacted healthcare in ways too numerous for any of us to truly comprehend, but particularly challenging was and continues to be the impact COVID has had on dying, death, and bereavement. People are separated from their loved ones, or they must choose between loved ones if they're in a restricted setting.
Seeing interruptions in the programs and the daily activities of our seniors, and some of whom have been self-isolated in their rooms for days, weeks, and sometimes months. They do not see their families, and they're not able to continue with their daily social interaction as before.
At work, responding to urgent tasks of providing timely and accurate COVID-related information was challenging, especially at the beginning of the pandemic when data sources were not fully established. At the same time, as a Black person, I was keenly aware of the disproportionate impact of COVID-19 on Black and marginalized populations. And this was compounded by the developments in the US and here in Canada around anti-Black racism. The need for proper race-based and socio-demographic data to address health disparities also became more pertinent.
Navigating through the uncertainty and trying to keep up with all of the public health guidance related to patients with COVID-19. But I think just in general, delivering care using remote patient monitoring presented nurses with a challenge of caring for patients in a whole new way.
We participate in an outbreak response meeting, and it'd be the first time that we were pausing to acknowledge that someone had died as a result of the pandemic, and needing to pause, create a safe and compassionate space for grieving, for emotion, and letting leaders cry and acknowledge that person's death, and try and have a moment to celebrate their life.
On January 22nd, 2021, while I had just arrived at Roberta Place, I received a call from Public Health Unit to state that I was now positive. So currently I am on a sick leave, recuperating. I know I don't look sick, but it was a very awful experience, and I will say I am now definitely a COVID warrior and a PPE warrior, and can't wait to get back to work and get back on to my next adventure and my next assignment.
I'm using sign language because my mother is deaf. She taught me sign language because she lives in a hearing world and she needed to communicate with her son. So what I saw over the last year was a tremendous amount of bravery. That's the sign for bravery. So many people have gone above and beyond to support our seniors, our staff, our caregivers, and all of the partners that support long-term care.
It was quite powerful to see the significance of supporting virtual care and access to digital health information, especially during the pandemic.
I'm very proud to have been able to support Ontario Health regarding the engagement with Francophone organizations such as the French language health planning entities, and to participate in a data collection project on Francophones with the Ministry of Health, and also to provide analysis, information, and advice about French language services.
A project that I'm most proud to work on this past year was implementing weekly tracking of and reporting of COVID-19 cases in the renal patient population. Dialysis patients tend to be at a higher risk of getting COVID-19 and unfortunately passing away from the disease. This work has involved a lot of information gathering, analysis, and stakeholder engagement to ensure that the data we provide back to regional renal programs is relevant to inform their response to COVID-19.
I was most proud to be a part of the distinguished team with the Population Health and Value-Based Systems known as Virtual Care Advisory Service. The onset of the pandemic led us to work assiduously and collaboratively night and day with other departments.
This year we had to adjust to holding these meetings virtually, so we all had to become experts at setting up virtual meeting rooms, breakout rooms, waiting rooms, and helping attendees with whatever problems that may occur during these meetings. So I'd like to give a big shout out to my teammates, Christian Gant, Stephen Johansson, and Ashley Potts under the leadership of Ann Corbett.
As a surgical recovery coordinator, I am proud of the fact that our team continued the life-saving work that we do despite our reservations and our safety concerns. This was in part due to the support of TGLN's management through these challenging times.
Vaccines. So I think many of us are excited about vaccines, especially for the general population, and even like I'm excited to get my vaccine. But I would say that I'm most excited about how we're going to leverage our existing tables and structures, like the targeted neighborhood testing work, to bring vaccines to hard-hit communities.
I'm looking forward to the opportunity to connect with people, whether it be virtually and hopefully, if all goes well, at the end of the year in person. Really craving that free FaceTime of being able to sit down and talk about work over coffee or tea and meeting up after work.
I look forward to having a break and sitting in a meeting room and having meaningful conversations or silly conversations over a cup of coffee while we meet together face to face.
Looking forward to leveraging these different partnerships and relationships that we've built over the past year. A lot of times we wouldn't be even interacting in the same way without this pandemic. I think that's a silver lining that a lot of us are seeing. That because we had to work together very rapidly, couldn't wait for different pieces to go through all the same channels that we normally would, these relationships are built and forged in fire, so to speak.